Hi, my name is Dr. Lev Milovanchik, and I'm a hospitalist at UCSF. Today, we're going to be talking about determining capacity to make a medical decision for adults. So, the first thing we're going to talk about is what is capacity and why is it important. Then, we're going to talk about the four parts to determining capacity. And then, when a patient lacks capacity, what do you do? So, what is capacity and why is it important? Capacity is a person's mental ability, knowledge, or understanding to make a medical decision. And why is it important? Because our goal is to first do no harm and to provide informed consent to patients. How often do we have to do it? Really, every decision that a patient makes should include capacity assessment. And you have all the tools necessary to make this capacity assessment yourself. So there's four parts to determining capacity. The first is communication. Second is understanding. The third is appreciation of the situation and consequences. And the fourth is reasoning. Let's go through each one by one. So the first one is communication of a choice. The provider has to ask the patient to indicate a choice and confirm it. The patient has to clearly indicate that preferred option. A common pitfall we see is not ensuring that the patient has an interpreter if they're limited English proficiency, hearing aids, glasses, or family if they're dependent. Let's go through some examples. If the provider asks, can you tell me what your decision is about intubation? And the patient says, if I get so sick I need a ventilator, please intubate me, they've demonstrated capacity for communication. If the provider says, could I insert this IV to give you medicines for your heart? And the patient doesn't answer because of their illness, then they'll lack capacity for communication. The second is understanding. So a provider must explain choices clearly and to do teach back. And the patient must grasp the meaning of the information given to them. A common pitfall we see is assuming that the patient understands you. If you have to make sure that you speak to their understanding and make sure they understand everything you're saying. Some examples. If the provider says, can you explain to me why you need this insulin? And the patient says, my blood sugar is high right now and it needs to come down. Then the patient has capacity for understanding. If the provider says, could I insert this IV to give you medicines for your heart? I cannot give you pills to treat this condition. And then the patient says, no, I'd like to take a pill instead. Then they don't have capacity for understanding. The third part is appreciation of the situation and consequences. The provider must ask the patient about their condition, the proposed treatments, and the likely outcomes. And the patient must explain the consequences of the treatment options and their beliefs about them. First pitfall I often see is a lack of insight due to delusions or severe denial. And another is not assessing the patient's cultural or religious aspect of their beliefs. Let's do some examples. If the provider says, if you do not get this blood transfusion for your anemia, I'm worried you will get worse or could die. And the patient says, I understand I could die, but my religious beliefs do not allow for blood transfusions despite the consequences. That patient has capacity for appreciation. However, if the provider asks, could I insert this IV to give you medicines for your heart? I'm worried you will suffer if we don't treat this illness. And the patient says, I don't believe this heart condition is serious. The IV won't help. Then that patient lacks capacity for appreciation. Lastly, let's discuss reasoning rationally. If the provider asks the patient to compare and contrast the medical options and the consequences of all, and the patient's responsibility is to demonstrate the ability to explain why they are making their decision. The first pitfall I often see is forgetting to ask why a patient is making a decision. And another is forgetting that patients have the right to make bad or unreasonable choices in our minds. Don't judge. Let's do some examples. If a provider says, you are sick and I don't want you to leave the hospital, and the patient says, I know I'm sick and need medical care, but if I stay, I won't be able to pay rent and I might lose my apartment, that patient has capacity for reasoning. If the provider says, could I insert this IV to give you medicines for your heart? And the patient says, I called my fortune teller and he told me that if you put in this IV, my back will start to hurt, so I don't want it. Then that patient lacks capacity for reasoning. Let's say you've gone through those four steps and you've determined your patient lacks capacity. What do you do? So the first step is to figure out whether the patient has a surrogate, proxy, or healthcare agent. And if the answer is yes, you should call that person to discuss. If the answer is no, then think about whether the situation is life-threatening or limb-threatening. If it is, You have to make your best medical decision, and it might require restraints, medical or physical. If it's not life-threatening or limb-threatening, then is the cause of the lack of capacity reversible? If it is, see if you can spend the time to reverse it and then reassess. If it's not, well, first do no harm and do your best. Get help from a supervisor, and for the hardest decisions, call your hospital ethics consult. To conclude, capacity is a person's mental ability to make a medical decision. It's important because we want to do no harm to patients and provide informed consent. Anyone can make a capacity assessment, you or anyone. There are 4 parts to it: communication, understanding, appreciation, and reasoning. And if you need help, ask your supervisor and call an ethics consult for the hardest decisions. UCSF supports New York City. Thank you so much.